Okay, so let's get right into this because it's pretty shocking. The Indian government recently banned over 150 medicines. And we're not talking about some obscure drugs here. These are staples you'd find in literally every household. The list includes some names that are, well, they're probably going to surprise you.
Take this one, for example, Crocin cold and flu. I mean, who hasn't reached for this when they feel a sniffle coming on? It's a total go-to for so many people.
And what about this one? Vicks Action 500. It's a household name, right? Been around forever, synonymous with fighting off a cold.
Or maybe D-Cold Total, another super common one you'd find stashed away in pretty much any medicine cabinet in the country. Well, all of them, and I mean all of them, plus about 150 others, are now banned. And get this isn't even the first time this has happened. A similar ban hit 344 drugs back in 2016. So it begs the question, what on earth is going on? Why are these everyday, seemingly harmless medicines getting the axe?
Okay, so the answer really boils down to a specific category of drugs the government is trying to crack down on. They're called fixed-dose combinations, but you might know them by a more common name, cocktail drugs.
So what in the world is a fixed-dose combination, or FDC? It's actually pretty simple. It's just one pill or one syrup that mixes two or more different drugs together in a fixed ratio. Think of it like a pre-made cocktail, but for medicine.
And this slide, wow, this just lays it out so clearly. On the left, you've got Dolo 650. Totally safe, not banned. Why? It has just one active ingredient, paracetamol. Simple. But now look at the right, Dolo Cold. Banned. And you can see why. It's a cocktail of 4 different ingredients. This is exactly the kind of FDC the ban is targeting.
So, why the big crackdown? Well, think about it. Let's say you just have a simple headache, right? But you pop one of these cocktail drugs that also has medicine for a cough and a blocked nose. Your body is suddenly getting flooded with chemicals it just doesn't need, and that can really increase the risk of side effects. Even worse, if that cocktail happens to have an antibiotic in it, you could be building up antibiotic resistance without even having an infection. The truth is, a lot of these combinations are totally irrational. They're basically just a marketing gimmick.
But this brings up a massive question, doesn't it? If these drugs are so risky, how did they ever get approved in the first place? And this is where we start to uncover a story of loopholes, big profits, and a system that kinda seems to be putting patients last.
Let's talk about the money. There's a huge financial incentive here. See, the government has this list of essential medicines, things like paracetamol, and it puts a price cap on them to make sure they're affordable for everyone. But a company can take that price cap drug, mix it with another super cheap ingredient, and bam, they've created a new drug. Suddenly, this new cocktail isn't on the essential list anymore, which means they can get around the price cap and charge way more. It's a clever loophole, and it's totally legal.
And the push for profits? Well, it can get even more intense. You might remember the whole Dolo case back in 2022. The company making it was accused of giving away a mind-boggling 1,000 crore rupees in freebies to doctors. Why? To get them to prescribe their brand over others.
This whole thing got so serious that it ended up in front of the Supreme Court, and they didn't mince words, calling it a very serious issue. I mean, when you have this kind of pressure on doctors to prescribe specific, often more expensive drugs, it just completely undermines the whole point of affordable healthcare.
Okay, so let's take a step back. How is a drug supposed to get to market? Normally, it's a clear two-step process. First, the central government's main drug authority, the CDSCO, has to check the drug to make sure it's safe and that it actually works. Only after it passes that crucial safety check can the company go to the state-level authority to get a license to start making it.
But here is the giant, gaping loophole. For decades, many companies have just been skipping that critical first step entirely. They go straight to the state licensing authorities. And in a lot of cases, those state authorities have just handed out manufacturing licenses, no central government safety approval needed. This is how thousands of unapproved, irrational FDCs ended up flooding the Indian market.
So, the government finally steps in and bans these drugs. Problem solved, right? Well, not quite. The fallout from this broken system is pretty alarming, and a ban doesn't just make it all go away overnight.
In fact, and this is wild, if you go and do a quick search online right now, you can still find many of the drugs that were banned all the way back in 2016. They're still for sale, both online and probably in your local pharmacy. How is that even possible? Well, it's because the second a ban is announced, the big pharma companies take it to court. And with our justice system being, a bit slow sometimes,
These cases can drag on for years, and all that time, they just keep on selling the products.
All of this paints a really troubling picture. You know, India is famous around the globe as the pharmacy of the world, but when you look inside its own borders, a very, very different story is playing out. It's like a tale of two completely different faces. And this table just says it all. Take a look. The painkiller nimesulide, it's banned in the US, the UK, and most of Europe because of safety concerns. But in India, you can get it freely. It's the same story for these antibiotics. The lack of tough regulations has basically turned India into what some critics call a pharmaceutical dumping ground for drugs that are considered too risky for developed nations.
And this isn't just harming people in India, it's doing real damage to India's reputation on the world stage. Just in 2022, we saw two horrific incidents. In Gambia, 70 children died. In Uzbekistan, 68 people died. And both tragedies were linked to contaminated substandard cough syrups made by Indian companies. It's heartbreaking.
So this is the central paradox, right? On one hand, you have India, the incredible pharmacy of the world's biggest vaccine supplier, providing 40% of generic drugs to the US and UK, a country that literally saved millions of lives during the pandemic. But on the other hand, it's acting like a dumping ground where weak rules let unsafe drugs get sold at home and have even led to deaths abroad. The potential is massive, but man, so are the risks.
So, with a system facing so many challenges, you might be asking, what can I even do about it? Well, it turns out the power actually shifts back to us, to you and me, the consumers.
Look, when the regulations are weak and enforcement is slow, your first and most powerful line of defense is your own knowledge. It's really about being aware of what you're putting in your body. It's about questioning if you really need that multi-symptom drug for a single headache. And it's about talking to your doctor or pharmacist and asking about simpler, single-ingredient alternatives.
Ultimately, what we've seen is how a simple little pill can be part of this huge, complex story about profits, loopholes, and public health. So let me leave you with this question. The next time you open your medicine cabinet and reach for a pill for a cold or a headache, what are you going to be thinking about?